So much. Got the sniffles, perhaps a cough? Well, 5 to 20, that's a big gap. 5 to 20% of us get the flu each year in the United States, and more than 200,000 are hospitalized for flu-related symptoms. So how do you make sure you don't fall victim or make the person next to you sick? Well, Healthcare Partners physician Dr. Rakesh Kalra, not sick, joins us now with Preventative Tips. How are you?
Good. How are you?
Doing very well. Let's talk about the seasonal flu. How common is this? How big of an issue is this?
It's a really big issue, actually. The seasonal flu is actually a highly contagious respiratory illness caused by the influenza virus. Peak season is usually during the fall and winter season. Signs and symptoms of the flu include fever, body aches, cough, sore throat, runny stuffy nose. You can get some nausea, vomiting, and diarrhea.
Wow. Not a joy.
No, not at all.
The fever especially something to look out for to kind of differentiate it between cold and flu, because everything you see on the medicine cabinet says cold and flu, and I think people might think they're the same thing, but they're not.
They're definitely not, yeah. So during the season, if you don't necessarily have to have a fever, but it's one of the major signs that you can get if you develop the flu.
Is there a population that's more at risk of the flu than others?
Yes. Well, everybody's susceptible to the flu, but we worry about the complications of the flu, so such as pneumonia, dehydration, ear infections, and sinus infections. So usually children are at more risk, especially under the age of 2. Anybody who's pregnant, anybody who has a chronic medical condition like diabetes, heart disease, lung disease, and our seniors. So it's estimated that 90% of our seniors that are actually 90% of flu-related deaths and over half of the flu-related hospitalizations are in our senior population.
Wow, and that's why it's so important to protect ourselves and to be immunized.
Exactly.
How do we do this appropriately?
Well, definitely go contact your doctor, or there's many different facilities out there that are providing the flu shot. There are 2 different types of flu shots that are out there. There's the nasal spray and the actual flu shot. So the difference between the nasal spray and the flu shot is the nasal spray involves no needles, so it's really good. And pretty much as long as you're healthy in between the ages of 2 to 49 and you have no major medical problems and you're not pregnant, you can get the nasal spray.
Is one more effective than the other?
They're both equally effective.
Okay.
But if you have any questions, contact your doctor and discuss it with them. See which one is the right for you.
And this is why you're here. You're here with Healthcare Partners. I know you practice this total care model. Well, explain what that is for those who don't know.
Well, the total care model, we think it's a VIP service offered to our patients at no extra cost. It's a dedicated team of primary care providers, specialists, and dedicated staff who work together to manage all aspects of the patient's care and health. It's a really great program.
No question. And have everybody on the same game plan without having to be retested for the same stuff for every person that you might see down the way.
Exactly.
Saves a lot of money and a lot of time. I know there Medicare open enrollment. This is like a magical time.
Yes.
A lot of confusion in the air. I'm sure you're getting a lot of questions from your patients.
Medicare open enrollment's currently going on from now until December 7th. Healthcare Partners has set up a lot of different events to give our community education and provide them with information. And if you have any questions, please visit choosehcp.com.
And I mean, I know every year the Medicare, you might be on a plan. That plan can change from year to year. It might have the same name, but it might have different benefits that may or may not allow you to go to Healthcare Partners.
Exactly. The plans can change, the formularies can change, and even the cost can change. So it's very important to get to know your plan and get to know about the information regarding it.
Absolutely. Well, it's important to get to know your doctor as well. And once you're comfortable with the doctor, it's someone you don't really want to lose. As a doctor, I'm sure you have a doctor.
Exactly.
And once you find a great one, you want to make sure you can stick with that person, right?
Yep. That's.
How long have you been with Healthcare Partners? What location are you at?
4 years. I'm at Westlake Mead location.
Awesome. So if we have any questions about the flu or Medicare or my knee hurts, help me.
Yeah, exactly.
Give me a call. It's great having you.
Thank you. Thank you for having me.
Thank you so much. Again, steer clear of the flu this season, and if you get it, steer clear of me. You want to find out more about Healthcare Partners and the total care model, you can head to that website, hcpnv.com. It's right there on your screen.